I'm gonna introduce Mary Kate more officially as our learning session presenter today. We're really excited to have her and then Oma also as her colleague here today to talk to us about childhood cancer and the environment. And really quick, I'm just gonna make sure we're recording. Yes, okay. And we're going to be talking today about childhood cancer and the environment. She's got some resources for us, a little bit of education. And just to introduce Mary Kay, I love the picture she provided. It makes we love this kind of thing in Idaho, the outdoorsy fun. But Mary Kate is a certified primary care pediatric nurse practitioner and then the co-director of the Northwest Pediatric Environmental Health Specialty Unit, which I'm sure she'll introduce a little bit more about today. But with that, she's doing research in response to pediatric environmental health inquiries and finding ways to, apply what they're learning to understandable, actionable things for people to distribute and educate the public. So, and, serve the communities that we serve. So I'll turn the time over to her. I'll let her share her screen and we'll hopefully take some questions or have some discussion at the end. And then we'll wrap up with an evaluation. So go ahead, Mary Kate.
Thanks, Sarah.
Yeah.
Um, I'm glad you like the picture because every time I see it, I'm like, oh my gosh, I need to get a professional
Oh,
headshot.
I love it. It's very, very good.
All right, let's see.
I can stop my share if that helps.
Okay. Can you see that?
Yep, looks great. Thank you so much.
Awesome. All right. So, I'm not sure if everyone does have a flip book already. But if not, essentially what I'll be doing today is reading through the flip book with you, and I'll talk a little bit about what that flip book is, but then also sharing other resources we've developed as a part of this particular project, and just talking about the PACU program in general, because not a lot of people are aware of our program. But the focus of today's education will be childhood cancer and environmental exposures. So starting off with what the PACU program is, PACU stands for Pediatric Environmental Health Specialty Units. And there are 10 regions spread across the country. We in Region 10 are based at the University of Washington in Seattle, but we serve folks living in Alaska, Idaho, Oregon, and Washington. Our program is funded through the CDC and the EPA, as was mentioned earlier, and the vision is to create a healthier world for kids as well as pregnant individuals through education, outreach, and consultation. So, kind of in a nutshell, what we do on a daily basis is offer free services like this, providing education to various groups and audiences ranging from community health workers, public health departments, um, more clinical focused nurses and doctors on a variety of different children's environmental health topics. And then we'll also take individual consults from whoever reaches out to us. It could be an individual family that has a concern about their child having an exposure up to a larger community that's concerned about an exposure or a doctor that's wanting our help and guidance in managing um, a child with an environmental exposure. So this project is just one project going on at the PACU program, the Childhood Cancer and the Environment Project. It's relatively new, only been around for a few years, and only more recently have we shifted to focusing on doing community health worker education. But essentially, the why we're doing this project is to offer proactive and preventative information for families that can help them avoid potentially harmful exposures and reduce risk of cancer as well as other poor health outcomes, as we'll talk about. Um, Some quick facts to start us off. Childhood cancer is extremely rare. However, it is among the leading causes of serious illness and death in children and teens in the United States. And although the survival rates are much higher than in the past, thankfully, due to major advances in treatment, the overall rate has been increasing slowly over the past few decades. Cases of childhood leukemia have increased in the past 30 years, and increases in specific populations, particularly Latino children, are higher compared to other groups of kids. The exact cause of many childhood cancers is unknown, and many cancers in general it's often multifactorial. However, there's a growing evidence base that shows us that there are links to certain environmental hazards that we'll talk about today, including tobacco smoke, pesticides, and solvents, to the development of certain childhood cancers. So, if you have never used a flip book before, if you don't have it in front of you, this is what it's going to look like. Um, we decided to use this tool because we have some partners in the Region 6, the Texas PACU, that does a lot of community health worker education and training, and they've had a lot of success with the flip book. Um, so this is what it's going to look like if you don't have it in front of you. We have it in English and Spanish. Um, on one side of the flip book, the side that you would be facing out to you when you're speaking to whoever you're educating, whether that be another community health worker or whether you're talking with a family, um, that would be facing them, the learner side of the flip book, and then the educator side would be facing you as you're speaking with them. So it has a little bit more detailed information on the educator side, and more infographic pictorial version of that information on the learner side, but still getting that same point across. The flip book can be found at this website, or if you don't have it in front of you and you want to follow along, you can scan the QR code. I'll be sharing these slides as well, so you can access it online too. Again, it's in both English and Spanish, and we also have a few other educational tools on that website that I'll share at the end of the presentation as well. But throughout this presentation, I'll have the flipbook slides up on the screen, so you don't have to follow along on your own. I'll have everything displayed for you.
And can I just add, so for those of you that are joining us today and those that maybe are listening to the recording after the fact, we have copies of the books in both English and Spanish in Pocatello at ICU campus. I have them, so if you want to email me, we can coordinate. Or Ryan, Dr. Lindsay has them in Meridian, so at the Meridian ISU campus. So if you want to swing by and pick up a pack for your team, we'd love to send those to you that way. Or after this, I'll send out an information email with the recording and some of the other resources that Mary Kate and Oma share with us today. And we can also coordinate with you that way to like if you want us to get you some and mail them, or we can figure out how to get them to you. But we want to make sure and distribute those for you guys, Mary Kate and Oma. So there you go.
Thanks.
Yeah.
And one other thing I will say before we dive into it is I've done a few of these trainings now, and I've heard from some community health workers that they're really interested in getting all of the information that it's inside of the flip book, but it is 35 pages, and um, many of them gave the feedback that they can't see themselves going through this whole large flip book with a family. So just keeping in mind when you're using this tool, it's adaptable and you don't have to go beginning to end through the entire flip book for someone to get value out of this education. There are many slides that I think can be used alone and talked about for like half an hour. with individuals on specific topics. So the first half of the presentation is going to go into kind of the background of just general what is cancer, why are children at greater risk of developing cancer and being exposed to certain environmental toxins. And then the latter half of the book is more action focused and oriented. So, what can families do to prevent exposures to these specific chemicals? So, it might be that you're not going through that whole background on what cancer is with the family, but rather just focusing on some of the more action-oriented pages. So just keeping that in mind because I know it is a bulky tool, as we talked about before. So throughout the presentation today, I'll have, as I mentioned earlier, both the educator and the learner slide. Um, Again, as the educator, you would be um, reading through this more detailed um, side of the flip book, and then the learner, whoever you're engaging with, would be seeing the right-hand side of the screen. So this is just the intro page, kind of delving into what we're going to be talking about is childhood cancer, specifically leukemia, because it's the most common childhood cancer of which rates have been increasing over the past few years. And we're going to go again, generally looking at cancer, but really focusing on its relationship with exposure to certain environmental toxins. Um, we'll start by looking at, again, what cancer is and the different types of childhood cancer and some things that might contribute to the risk. And then specific pollutants, including outdoor and indoor air pollution, pesticides, and solvents. And then again, specific action items that families can take to help reduce their risk of exposure. So, cancer, a broad definition of cancer is a group of diseases in which abnormal cells reproduce without control and can invade nearby tissues. These abnormal cells can spread to other parts of the body, either through the blood circulation or the lymphatic system, which is an important part of our immune system. And that's what's pictured on the right-hand learner part of the flip book. And I really like this infographic. So normally cells grow and divide in an orderly process, as you can see on the left side of that infographic. And then comparing it to the development of a cancer cell, in which an abnormal cell grows and divides in an uncontrolled way. Some of the most common childhood cancers, and again, childhood cancer is rare, but the most common types are typically leukemia. Um, this is a blood cancer. It starts in the blood-forming tissue in the bone marrow and is what a lot of the research around environmental exposures in childhood cancer is focused on because it is the most common. Other types of childhood cancers that are more common than others include brain cancer, lymphoma, neuroblastoma, sarcoma, and Wilms tumor and other kidney tumors. Although pediatric cancer is rare, the incidence of many cancers in children's and teens is increasing in industrialized countries. It's the second leading cause of death overall and first leading cause of disease-related death among children and teens. So you have to wonder what could be playing a role, and the environment must be a contributing factor in these upward trends, either alone or in combination with an increase in different genetic susceptibilities. And then these statistics are kind of harrowing, but 46 kids are diagnosed each day, 16,000 each year. Again, there's been a pretty significant increase in childhood cancer since the 70s. And of course, the cost for families as well as on the healthcare system is significant as well. And as I mentioned at the beginning of the presentation, the rate of childhood leukemia specifically has been increasing even more amongst Latino children. This infographic on the right-hand side of the screen demonstrates this increase over the past 30 or so years. For a particular year, each bed represents one extra new patient with acute lymphoblastic leukemia, which is a subtype of leukemia, per 1 million healthy children. So this increased 35% for Latino children, and this was specifically California data, looking at hospital admissions and diagnoses in their cancer registry. However, this same trend of greater increases in Latino children has been also demonstrated in national cancer data when compared to other groups of children, including white children, Black, Asian, Pacific Islander, and other populations. There are other cancers among those more common childhood cancers that are also on the rise, such as brain cancer, which was the second most common children's cancer. And something else to think about is that, as I mentioned earlier, thankfully, more kids are surviving cancer than ever before because of the great advances in treatments for childhood cancers. But it's also important to consider survivors of childhood cancer as they are at risk of health effects for the rest of their lives related to the treatment that they endure to become survivors. Um, Children who survive childhood cancer are often followed for their lifetime in what's called survivorship clinics. These are special follow-up clinics for kids who have been treated for childhood cancer, even if they're now in adulthood. And of course, childhood cancer is an extreme burden on the child and their family. Um, I don't think I need to tell all of you, you're all familiar with the healthcare system and a lot of this information, but years of medical tests and treatment, time spent in the hospital, again, the significant financial burden that families are often faced with. And then children must be followed for treatment-related health problems for the rest of their lives in survivorship clinics, so it can be significantly stressful. Throughout the flip book, you'll also find activity ideas as well as prompts for discussion. So you can see there's a prompt for discussion down here. Um, this was another thing that we've had mixed feelings in our presentations on from community health workers, specifically this prompt for discussion. It can be a really sensitive topic for people to talk about, and it might not be it might not be something people want to be brought up. So you don't have to utilize these prompts for discussion. And I think in the next year of this program, we're going to be taking a lot of that feedback and potentially changing some of those. So moving into how the environment plays a role in the development. Um, Although the exact cause, again, of many cancers is difficult to determine, many factors contribute, such as genetics, our environment, and exposure to toxic chemicals. And again, that's what we're going to focus on today. So why are kids more exposed to toxic chemicals? So kids are more exposed because they're eating, drinking, and breathing more for their size compared to adults. Kids are also often being exposed to things that adults wouldn't just through normal behavior, such as crawling on the ground and mouthing, exploring their environments through hand-to-mouth behavior. Um, Kids also absorb more chemicals due to thinner skin compared to adults, and have a larger body surface area compared to adults. Kids are also more vulnerable to these exposures because they're growing and developing rapidly. We'll talk about that on the next slide. So babies in utero, as well as kids and teens, are more vulnerable because their bodies and particularly their brains are growing and developing rapidly. These are called windows of vulnerability, and can be disrupted by very small amounts of chemical exposures. And adults don't have any similar windows of vulnerability like kids do. So kids are more likely to be harmed by toxic chemicals because they have higher exposures because of what we just talked about on the last slide, and because they're still developing and their bodies can't get rid of some of these chemicals as easily as adults can. And kids can be exposed to chemicals in many different environments, whether that be indoors, at home, schools, childcares, outdoors through our air, water, soil, and food. Chemicals, depending on what kind of chemical it is, it can get into our body through breathing, eating, drinking, or through our skin contact. And pregnant individuals can also pass toxic chemicals to their child in utero. So that is a lot of information. And so now we're going to shift into kind of more of the action-focused information about what we can do to lower children's risk. So minimizing kids' exposure to some of the environmental chemicals that we're going to talk about today in order to lower their risk for developing childhood cancer, as well as other health issues that are associated with exposure to some of these chemicals, including asthma, learning disabilities, and immune system problems. And then again, coming back to the children who have survived childhood cancer, it's also important to consider them when we're thinking about lowering children's risk, because they are again at higher risk for secondary cancers and other problems related to that initial treatment. So thinking about starting protecting your kids' health even before they're conceived, as well as during pregnancy. Some of these healthier choices, such as quitting smoking, eating healthier foods, and avoiding toxic chemical use in the home, workplace, and play areas where you're spending a lot of time. We've got some pretty good data that shows us that cigarette smoking before conception can really cause damage to a baby's DNA. And that is if the mom or the dad smokes cigarettes, actually. Um, and then, of course, we will talk about diet a little bit on the next slide, but a healthy diet starting early in pregnancy is very helpful for protecting the baby from the development of childhood cancer as well as birth defects. So, thinking a little bit about diet, even before getting pregnant and during pregnancy, it's important to, of course, eat a healthy, varied diet with fresh whole foods. Taking prenatal vitamins is critical. Of course, we know this because the folic acid is really important to protect babies from neural tube defects, like spina bifida, but it is also important, has been shown to reduce the risk of the development of childhood cancer as well. Avoiding alcohol completely, of course, and limiting caffeine. And then breastfeeding has also been shown to be, after the child is born, breastfeeding has been shown to be highly protective against the development of childhood cancer. There's data that shows us that breastfeeding for 6 months or longer is best after baby's born because it, along with reducing the risk of childhood cancer, um, protects baby from other things like infections and provides important nutrients. Um, However, the general provider in me always comes at this from the fed is best perspective too. So that can be a sensitive topic to talk with people about as well, but just something for you all as the educators to be aware about is there is a decent amount of research showing that that's really protective. Today, again, focusing on some of these environmental exposures, and we'll go through them one by one in ways that we can reduce risk. And we have some activities that we can do as well. Um, since I don't want to go over time too much, but I'll explain how you would go through the activities with your learners. So first starting off with air pollution, outdoor air pollution. It's caused by solid and liquid particles and gases that comes from things like um, various industries and factories, vehicle exhaust, wildfire smoke, dust, pollen, mold spores, etc. And a really simple way to decrease exposure to outdoor air pollutants is to increase our awareness of what it means when the air quality is poor so that we can make decisions based on that air quality index, which is what is pictured here on the screen. I feel like people are becoming a lot more aware of this tool because it's now embedded into a lot of smartphones' weather apps, so you can see it automatically. So there's an increased awareness because of that. However, if you've not used it before, you can scan the code right there to access it. There's a website as well as a mobile app, or again, you can see it on your like Apple, on the Apple Weather app, it has it. So this tool shows you what the air quality is. So it's categorized from good to hazardous. And what value it brings is that it gives recommendations for who should and shouldn't do certain outdoor activities on days when the air quality is X, moderate, unhealthy, good. Um, one activity opportunity when you're doing this education with families to break things up is to go through downloading this on their smartphone if they have one available, or if you have one to show them on, or figuring out ways that they could access it if they don't have a smartphone. They often talk about the AQI on local radio and news stations as well when they're doing weather reports. The website also has activity guidance fact sheets that you can print and give to families that they can use to determine what activities are safe based on what the air quality is and if they have certain underlying health conditions. So, for example, all children, no matter if they have other health conditions, are considered a sensitive group. So if the air quality is in the moderate yellow zone, families may consider choosing indoor activities instead of outdoor activities, or if they really want to engage in an outdoor activity, perhaps choosing one that's shorter and less intense, like going for a family walk versus playing a high intensity sport where you're really exerting yourself and breathing in more of those air pollutants. And then wildfire smoke, I know that Idaho can be impacted as well. And so I like to call it out specifically. Um, Reducing exposure to wildfire smoke, which has many harmful chemicals in it, is important. And some simple steps that you can use are outlined here, such as keeping kids indoors with the doors and windows closed if it's safe. Unfortunately, wildfire season is also accompanied oftentimes by extreme heat patterns that we're seeing more frequently nowadays. Um, if you have an air conditioner, running it in recirculate mode so you're not bringing that dirty air into the house, using some portable air cleaners, having kids wear masks if they need to go outside. And for wildfire smoke, the particles are so small that really the only type of mask that filters out those particles effectively are the big honkin' N95 or the KN95 masks. Often you'll see people with like a bandana or something covering their face, which might prevent you from smelling the smoke, but it doesn't do anything to prevent you from breathing in those harmful particles. So thinking about indoor air pollution, you can see there's many potential sources of indoor air pollution, so I won't go through each one here, but I just kind of like this infographic showing you the various places in the home that there can be indoor air pollution. Not all of the ones listed on here are directly associated with the development of childhood cancer, but some are, such as cigarette smoke, which I mentioned earlier, and then radon, which is a colorless, odorless gas, which is actually the second leading cause of lung cancer in the United States after smoking. So decreasing exposure to indoor air pollution. Again, I won't go through every step here, but simple things like limiting sources of indoor air pollution. So limiting the development of indoor air pollution. So not smoking inside, using cleaning products that have safer ingredients, um, using air purifiers, not using candles or other fragrance developing items like air fresheners that can often have harmful particles in them. Um, and then, aside from not creating additional indoor air pollution, keeping the air clean through ventilation, which is as simple as opening the doors and windows, assuming the outdoor air quality is not poor, and then filtering the air, um, whether that be through your central air system or air filtration devices like an air purifier. However, air purifiers are really cost prohibitive for most people. Um, but there's many resources out there on how to develop this DIY box fan filter. So it's effectively as good at removing harmful particles from the air as the $400 air purifier that you can buy. So it's at a much cheaper price. So this is another activity opportunity. These QR codes take you to the instructions, and there's like, I think it's like an 8-minute video of them demonstrating how easy it is to develop these box fan filters. So you can look up that video together. You can possibly look up stores nearby where families might be able to purchase some of those materials. And then also checking in with your local health department can be helpful because some health departments in wildfire smoke prone regions do get grants to purchase a lot of the materials to develop these and then host events where they give out these materials for free. So I always recommend, especially if it's during wildfire season. So right now, into the early fall, a lot of health departments are offering that service. So always something that you might want to check in on so that you can tell families about that if they're interested. Talking about house dust a little bit, along with indoor air pollution, toxic dust can hang around your house even for years. Even dust and toxins from previous tenants, if you're renting, can stick in those carpets. And then again, kids are exploring their environments. They're closer to the ground. They have a lower breathing zone. They're putting everything in their mouths as they explore their environments. Um, so simple steps outside of getting the carpets cleaned because that can also be really expensive. But easy things like washing kids' hands after they've been playing, and especially before they have a meal or a snack and they are putting their hands in their mouth. Um, Quitting smoking again, it often comes back to that because that can leave a lot of harmful particles in the carpet in homes. And then leaving shoes in outdoors so you don't track in stuff into the home. And then there's a few other tips on here for cleaning carpets. Um, these next few slides are specifically around smoking. So tobacco smoke particularly is made up of thousands of chemicals, and many of them, at least 70 of them, are known carcinogens or cancer-causing chemicals. Um, a list of some chemicals found in tobacco smoke are there, many of which, like benzene, are known carcinogens. And as I mentioned earlier, we have a decent amount of evidence that I was pretty surprised by when I first learned about it, that there was research showing an association between fathers smoking before conception and increased risk of their offspring developing childhood leukemia. And then smoking doesn't only harm the person who's smoking it, of course, it harms those around them as well. So there's dangers of both secondhand and third-hand smoke exposure. So secondhand smoke exposure you might be more familiar with, or when people around the person smoking are breathing in those chemicals. But third-hand smoke exposure is actually exposure due to a chemical residue that's left behind after someone smokes. So, again, going back to someone smoking inside the house, that residue and those chemicals can stick around on materials like carpets, flooring, walls, bedding, curtains, um, and other surfaces in the home, and be a risk for exposure for others afterwards for long periods of time. Um, Move, how long am I doing on time? I don't want to rush too much, but I also don't want to
Right. Um,
not.
I think Ryan correct me, but she could probably you can go to like 320.
Okay. I only have like 10 slides
Yeah,
left,
I think you're
so
just
I
right
should.
on. So
Okay,
no worries.
perfect. I'm rushing through them a little bit, but
And I
uh,
guess like 320, like if you want a few minutes for questions, whatever you want.
perfect. Thank
Yeah.
you.
Yeah, of course.
Moving on to pesticides. So pesticides, by nature are designed to kill or control living things such as weeds, insects, rodents. Um, some examples of pesticides that are more commonly used, like in and around the home, are rat poison or traps, ant spray, weed killer, mothballs. So by the nature of pesticides that they're designed to kill or control living things, they can all be potentially harmful if exposed to them. So again, there's lots of things that you might not consider a pesticide that are widely available to purchase and use in the home, but that doesn't necessarily mean that they're safe. Pesticides can cause poisoning right away, or health effects right away if exposed to it, which is called an acute effect. Or they can cause illnesses or affect development long after exposure, so more chronic exposure. Pesticide exposure during pregnancy and early childhood has been linked to increased risk for the development of childhood leukemia, as well as certain brain tumors. And another interesting piece of evidence that I learned as a part of this project that I was kind of surprised by is they did a study and found that fathers' exposure to pesticides, again before conception, had been linked to their future child developing childhood leukemia. That was in a pretty big study out of California. Typically, the harmful effects of a pesticide, as is with many environmental exposures, depend on how poisonous it is. Not all pesticides are created the same. Some are more poisonous than others. It depends how long you're in contact with the pesticide, and how much of it gets inside the body of the exposed person. Again, children are particularly at risk from exposure. Some potential long-term health effects outside of development of childhood cancer include asthma, low birth weight if exposed in utero, birth defects if exposed in utero, some learning disabilities or hormonal changes. And this infographic on the learner side of the screen is just demonstrating that children are exposed to a greater amount or a greater amount of the pesticide will be taken in by the child in proportion to their body size or weight, compared to an adult. So decreasing our exposure to pesticides, washing and scrubbing. Oh, this is particularly exposure from food. So simple steps like washing and scrubbing our produce, throwing out the outer leaves where pesticides often accumulate, trimming the skin and fat from our poultry, fish, and meats, again, where pesticides often collect. Purchasing organic when possible, but importantly, not at the expense of a diet that's rich in a variety of fresh fruits and vegetables. And another activity opportunity here, if you're talking about this with families and they're really interested in learning about this more, there's something called the Environmental Working Group, and they have what's called the Dirty Dozen and Clean 15. Um, which goes over produce that year that is more likely to have pesticides on it. So produce that you might consider purchasing organic if that's within your means, because that means that it wasn't isn't going to be have as great of a pesticide burden on it. And then the clean 15, which are least likely, and produce that you could probably don't need to worry about purchasing organic. But again, a big disclaimer on this Dirty Dozen Clean 15. The most important thing, of course, is having a diet that's rich in a variety of fruits and vegetables. Um, so this list just offers suggestions for families if they're interested in learning about what produce they might buy organic if possible. Um, these are some methods to decrease pesticide exposure in and around the home, school, or childcare. Using least toxic options. If we think about disinfectants, like your Clorox spray, that's considered a pesticide as well because it's designed to kill germs. So using least toxic options, and our program, the PACU program during the COVID pandemic, did like a ton of education about safer disinfection options. So you can check out our website to learn more about that. Um, Other simple things, leaving shoes outside the home to prevent tracking in pesticides, especially if you're living in an area where there's a lot of agriculture around and nearby. Washing hands with soap and water, especially before eating, um, and goes into a little more detail about how to choose safer products when you're purchasing them at the store. And the EPA has what's called the Safer Choice Program, so they have a lot more detailed information on their website as well about that. And then if you're in an area, I know in like Eastern Washington, I'm not sure if some areas in Idaho, if there's a lot of agriculture that happens. But if you are working with folks that are ag workers, and they're working with pesticides a lot, there's the risk that they bring those residues home on their hands and clothes. This is what we would call a take-home exposure. So simple tips to avoid take-home exposures are changing clothes at work, and showering before leaving work if possible, removing shoes at the door before coming inside, washing hands. Again, a lot of these are reiterated throughout the presentation and can reduce exposure to many different chemicals, um, and not using chemicals at home that are meant to be used in the workplace, of course. And this is our last one, our last exposure that I'll talk about, solvents or volatile organic compounds. So these are a big group of chemicals that are widely used as ingredients in household and personal care products. So like a really broad category of materials. We're exposed to them usually by inhaling the vapors, and they can be absorbed also by the skin or the mouth. So some examples that we might be exposed to in the home are like paints and paint strippers, cleaning and disinfecting products, odor masking products, or fragrance producing products, Personal care products such as nail polish and nail polish remover, hairspray, perfume and cologne, fuels such as gasoline, pesticides, building materials and furnishings, and then certain crafting materials, even like glues and adhesives, permanent markers, and photography solution. So lowering your exposure to harmful solvents and VOCs, shopping smart. So there are certain types of products, such as disinfectants, like I mentioned before, that have these logos that you see on the learner side of the screen. These are third-party testing organizations that will allow a manufacturer to put that logo on there if they've been tested and proven to be both safer for human health, and still effective at getting whatever job it's meant to be done. There are many products nowadays that are labeled as low VOCs, like paints and personal care products. So looking for that on labels, choosing unscented products whenever possible, safely disposing of unneeded or unused products properly, and keeping these locked or out of reach of kids. Um, and then this is another activity opportunity when you're talking about this with families, if they're interested in looking for or purchasing safer alternatives, perhaps recommending that they take a look in their cabinets and seeing if they can find any of these logos on products they already have. Or next time they go to the store, seeing if they can find some of these logos on various products. And I won't go through all of this. This is a lot of the same information that we talked about when we talked about reducing indoor air pollution. So thinking about not using those sources, so not adding to the indoor air pollution, and then ventilating, so opening those windows when possible, and then filtering the air if possible too. Okay. So these are some other resources that we've developed as a part of this project. Um, this is probably one of my favorite resources that we developed because it basically goes through a lot of the information that I just went through, but in a really nice, like brochure 4-page style. So it kind of succinctly summarizes some action items that families can do to reduce risk of exposure. I don't know that we had these available to send to you all, but they are available on that website. Um, that again, I'll share these slides so you can have access to all the links and everything. But the website that I had the QR code at the beginning of the presentation for.
And we'll make sure and share that again when we send out the email that the recording's available. So,
Awesome.
yeah.
This is available in both English and Spanish as well. Um, and then one more material that I wanted to mention is a graphic novel called Rosa and Carlos Get Married. It's a graphic novel, so I think it's really fun for maybe older children or adolescents to share with them. I believe we do have copies of this if you wanted any. But it tells the story of a young couple that are going to get married, and they go to their mother, who's a nurse, and ask about how they can reduce risk of exposures as they're thinking forward to the future about having a child one day. And that is the end of my presentation. This is a totally voluntary um, survey. It's really brief. It should take less than 5 minutes. But if you do have any feedback, it's really helpful for us as we move forward in another year of this project, just to hear what you thought of the presentation, of the materials, and what you think we could improve going forward. So I would appreciate it if you were able to fill it out. And I can, again, you'll have access to this. You don't need to fill it out right now. I'll share the slides and you can do it in your own time.
Awesome. Yeah, and we can also send this out too when we like put it with the recording. So those that watch it after the fact can still give you some survey feedback. So hopefully that
You.
helps. Yeah, of course. This has been really interesting. I'm a mom of two toddlers, so I like understand all the exposure and I'm like, wow, I really need to think about these things more.
There's a
So
lot to think about. And that, again, as I mentioned, that was some of the feedback that we got from CHWs and previous trainings that it can be overwhelming and a little scary to talk about this topic with people. So yeah, I think a lot of the ideas that we had from the last group while we were discussing was to really just do it in bite-sized pieces when you're engaging with people and just take it one topic at a time. Pick what they're most interested in that day to talk about and yeah, so you don't overwhelm.
yeah, I see Ryan put something in the chat. Okay, sweet. But I think so Ryan just shared some trends for Idaho in the chat, which I know Mary Kate talked about like national trends and Idaho's very closely following those. So I just want to give a couple minutes if there's any questions for Mary Kate about their program, about what she talked about, the educational materials. If you have any questions about how to get those things, we can answer those now. If anyone wants to come off mute and chat, I'll just open the floor to questions. And then in the last 5 minutes, I'll switch and I'll have everyone do our mini learning collaborative evaluation survey. So,
And if questions come up later, my email's on there as well that can be shared with everyone. Or if you end up doing this training and sharing this information and people you're talking to have questions, again, we offer that free consultation service, so you can always direct them our way.
yeah, so it's a great resource, right, to share what your program's doing. Um, and it's kind of like what you were saying, where it's maybe not the most common thing to come into be working with someone that is dealing with childhood cancer, but the times that it does happen, if having those resources is really beneficial for anyone, any health team member, including CHWs, to be aware of those factors
Yeah, yeah,
and the prevention piece, right? And we're very like heavily agricultural in many areas. So
I
um,
figured, yeah.
between that and the few golf courses we have, I'm sure that
Mm.
even in town we've got places that are high exposure areas. So okay. If there's no questions, I'm gonna share my screen really quick before we disperse today. If you don't mind, is everyone seeing my slide? Hopefully, not my email. Okay, and then I am so grateful that we were able to have Mary Kate and Oma, reach out to us about this program. I have a cute little box of these amazing flip books. I'm just gonna like demonstrate what they look like. They're full of all of the things that she went through today, in a format that's really easy to use, like what she was saying with like, this is the side they see, this is the side you see. So we definitely want to make sure that these get distributed to the different teams that we have across Idaho. So, thanks for your time, Mary Kate. And I mean, feel free to reach out to us if we can, distribute any information in the future in our newsletters or any events that you guys are putting on, as well. I see some chats coming through. I'm not keeping a very good eye. Yes, Ryan just is
Thank you.
excited
And
about the flip books. Which I am too. I'm like, okay, maybe I should almost do it with my family. I'll do it with my kids and my husband. So I love it. Okay, so thank you everyone for participating today. We'll make sure and I'll follow up with Mary Kate too in an email to make sure we have all the resources and links in an email that we send out to everybody that was registered, which I know a lot of people were registered that did not attend today. So we'll also share the recording of the educational session with everybody through our YouTube channel. So And that we always have available. It's like in our library now for CHWs to refer to and we can include those resources with that. So yeah.
Awesome. That's great. Thank you
I
so much
also
for having us.
I will also include with all of the resources that we sent out. I mean, I think this topic's super important, and there's a lot of resources in Idaho that would be helpful for community health workers, and I've just started to compile some of those, but I will put those out with the information. It's just a starting point. You all probably could help build that out, but yeah, I wanted to make sure that some of the things, I mean, there's services for people that already have been diagnosed with a pediatric cancer that are great resources out there, like Camp Rainbow Gold or in the Treasure Valley area to support cases. But there's also lots of programs through Idaho Department of Health and Welfare to help get radon testing kits and other things that I want to make sure that you're connected to. So we'll send that out with all the other information.
All right, I think that concludes our time together. So we appreciate everyone's participation. The little breakout rooms were fun, so I'm glad we were able to do that. And then we'll make sure and send out an email probably tomorrow with the information and the recording copy for everyone to share with their teams. So thanks, everyone.
Thank you. Nice to meet you all.
Yeah, nice to meet you.